Hello and welcome to my presentation. My name is Charlotte Constable Fernandez and I'm based at UCL. I'll be talking through a paper that we recently published entitled Proximity to High Streets, Social Isolation and Social Support in British Adolescents, a longitudinal analysis of socio-spatial influences on social connectedness using geospatial data. This paper was recently published in Health and Place, and this work was conducted with colleagues at UCL and at City University. So it's widely accepted that the built environment and spatial factors are important for health. And so in this paper we combined survey data and geospatial data. And in this presentation I'll give a background as to why we chose to look at high streets and social isolation, also go through the aims and methods and the results of this paper. So why the UK high streets? High streets are traditionally the heart of urban communities, and they offer unique settings for social engagement and community integration. Social well-being is a key dimension of high streets, as they can foster social interactions and a sense of community by acting as an accessible social space. The role of high streets is varied. It's not just retail. It brings people together for many different reasons, including socialising and healthcare, and also travelling through to work and to transport links. Therefore, accessibility and proximity to the high street can provide adolescents with freedom of mobility without depending on parents or others for transport, as public space tends to be important for adolescents. So we looked at social isolation. Social relationships are intrinsic to well-being, and social isolation in young people is associated with negative mental health outcomes, including depression and anxiety. But there is a gap in the evidence around how social isolation and social support during adolescence interacts with the wider built environment. Adolescence represents a sensitive phase in life marked by significant changes in social bonds and is a peak period for the onset of mental health problems. Social isolation is generally considered as an objective measure based on the quantity of social connections and the number of ties. It is distinct from loneliness, which is defined as a distressing mismatch between a person's desired and perceived quantity or quality of social relationships. To our knowledge, no previous study has explored the association between high street proximity and diversity and social isolation in UK adolescents. The aims of our study were to investigate the relationship between proximity to high streets at age 14 as a proxy for social opportunities, and social isolation and social support at age 17. We hypothesised that greater distance from the high street might increase social isolation. This was measured through social activities, friend contact and social support. Moving on to our methods. We utilised the Millennium Cohort Study, which is a birth cohort nationally representative of around 19,000 children born across the UK between 2000 and 2002. So as you can see, data has been collected at various ages. We used data collected at age 17 and we used the postcodes and geospatial data from age 14. So at age 17, participants from England, Wales, Scotland and Northern Ireland completed an online self-completion questionnaire, which included responses to questions about social isolation. So social isolation at age 17 was measured using frequency of various social activities and contact with friends. So for example, questions included asking how often adolescents would go to a house party, nightclub, theatre, go to watch live sport, go to live music, or go to youth clubs. Participants were also asked about the frequency of contact with friends outside of school. We captured perceived social support using the social provisions scale. So we used postcodes data collected at age 14. Network distance was then calculated between the postcode centroid and the nearest high street. So this is measured as the shortest path through the street network between the postcode centroid and the nearest start, end or intersection of a high street. We used geospatial data from the Ordnance Survey, including the Ordnance Survey Retail Geographies package. We also captured differences in high street character by using Land Use Diversity Index. So it's a diversity index is the indicator of the number of different land uses present. So high streets with a greater mix of land uses are considered to feature a higher potential for social interaction. We also examined an exponential distance decay function to explore non-linearity. So distance decay functions continuously decrease values until converging to 0. So there's rather than an abrupt cutoff at a preset distance. So in this figure, you can see a hypothetical participants' postcodes and the two shortest paths to the nearest high street entry points. And then the graph shows the visualization of 3 distance decay function. Each line corresponds to a different model, illustrating variation in decayed distance. We use random intercept multi-level regressions to assess proximity to high streets and the 3 social isolation outcomes separately. Multi-level modelling can account for neighbourhood clustering, so individuals within the same geographical areas are more likely to be more similar and have correlated observations. We included several covariates, including sex, ethnicity, rental education, occupational status, income, and wealth. We then also used multiple imputation for missing data. Moving on to our results. Our analytical sample was around 5,500. At age 17, 55% of participants said that they participated in a social activity at least once a week or every day, and 69% of adolescents reported contact with friends at least once a week or every day. The mean distance to the closest high street was 2.2 kilometres, whilst 36% lived within around a 10-minute walk of their closest high street. 11% lived over 5 kilometres away from a high street. So we found no association between distance to their high street and frequency of social activities in males or females. We also found no association between the diversity of the closest high street and frequency of these activities or social support. So our findings indicate that the distance to high street may not be as important for social activities, social contact and support for adolescents as we had hypothesised. So we conclude that adolescents may socialise in spaces other than around the high street, including online. In the current study, social contact was measured as how frequently the respondent sees friends outside of work or school, but we did not include communication via social media, gaming or mobile phones. So this approach overlooked the extent to which adolescents use social media to maintain social relationships. So some previous research has also suggested that increased social media use leads to the displacement of face-to-face interaction among adolescents. There are some limitations to our work as well. We did not consider the quality and character of high streets. Although we include a diversity index, which is indicative of a healthier high street, it doesn't include measures such as local crime, aesthetic, places to sit, or other features of high streets which may impact their usage for adolescents. We did also not consider neighbourhood perceptions. So adolescent perceptions of their local area and their local high street could be an important factor in socialisation that we did not consider. Address level data was not available due to confidentiality, so we utilised postcodes, which is not as a precise measure of the home location. So our next steps and implications, we suggest further qualitative work to understand adolescent perceptions of their high streets and local area, which may include walking interviews or GPS-based tracking of participants. We also think it would be important to investigate our hypothesis in older cohorts to compare findings, as high street proximity may be important for other age groups. Here are a list of my co-authors and my contact details should you wish to get in touch. Thank you very much for listening.